Good morning, everyone. I'm Rebecca Vickers with the Florida Alcohol and Drug Abuse Association, and we will get started right at 10 o'clock this morning. See you all then. Good morning, everyone. I am Rebecca Vickers, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled A Collaborative Community Approach to Reducing the Risk of Child Welfare Removals for Postpartum Women Experiencing Opioid Use Disorder with Kathryn Shea. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode and will only be able to view your name. If you have questions, please send them to the presenter and me, the host, by using the chat panel. The button to open the panel is usually located in the lower right side of your monitor. Please use the chat panel to send any questions you have as you think of them. The presenter will address questions as time permits. Our audio is broadcast through the internet to your computer. If you experience poor computer audio, there are a few options to try on screen right now, and these options are posted in the chat panel too. If you continue to experience poor audio through your computer, try rejoining the webinar and use the I will call in telephone option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on the FATA website within 30 business days. To access the recording and the PowerPoint, go to www.fata.org, then to our Resource Center, and then to our training library. FATA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides a personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will direct everyone to an evaluation form on FATA's website. You will first need to register or sign in to your account to complete the evaluation. Information you provide FATA as a part of registering remains confidential. Statements of credit will be posted within 30 business days after the evaluation closes in individual professional development journals for persons completing the evaluation and attending the full webinar. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Do note that the evaluation will close Tuesday, November 23rd. Up to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license numbers for reporting to CE Broker when you register with our site for the first time. If you are certified with the Florida Certification Board or licensed outside the state of Florida, you do not need to provide your certification number when you register with our site. Please note that WebEx monitors arrivals and departures of attendees and provides a report upon completion of the event. We are not permitted to provide a certificate of attendance if you do not attend the entire webinar, and we are not permitted to provide partial CE credit. Kathryn Shea has worked with children with serious emotional and behavioral disorders, including fetal alcohol syndrome and drug effects, for over 40 years. Ms. Shea has received numerous awards for her work in infant mental health, fetal alcohol syndrome, and child advocacy. She currently serves on the board of FASD United, formerly NOFAS, and is an independent consultant for the local, state, and national level. And now I'd like to welcome our presenter, Kathryn Shea. I will turn the presentation over to you.
Thank you very much, Rebecca, and welcome everyone to today's webinar. I'm very excited to be able to be with you this morning and to present to you this webinar. These issues are very near and dear to my heart, and as Rebecca said, I've been involved in this work for over 40 years, but you all must remember that I started when I was 10, so that we just have a little bit of perspective there. So we're just going to jump right in. This is a 2-hour webinar. We will end right at noon. And at about the 11 o'clock point, we will take a 5-minute break. And I know that's a short break, but that's what we are permitted to do within this 2-hour webinar. Enough time for you to get up and use the facilities, hopefully, and get some water. And it's very important to make sure that you stay hydrated when you are on these Zoom and webinar calls a lot during the day, which I think many of us still are. So make sure you've got something liquid beside you, and we're going to jump right in with our next slide. And that's our learning objectives. So what we are going to learn today is that we're going to list the benefits of collaboration between substance use disorder treatment programs and community hospitals and neonatal intensive care units. We're going to assess effective engagement and treatment strategies for serving pregnant women with opioid use disorder. And we're going to talk about some of the common barriers faced by pregnant and postpartum women with opioid use disorder. And I'm going to do this by sharing a model that we've had in Sarasota County now for a number of years that came together as a result of the opioid use epidemic, and a very collaborative community project of a number of organizations, which you will learn about in a little bit. And it's called ASAP, and that stands for Addiction, Support, and Pregnancy. And so we're going to learn about how that came about and why it came about, and how every community, if we all pull together in our communities, we can become very creative participants, all playing in the same sandbox nicely together and creating some wonderful solutions for our children and our families and our pregnant women. So objective 1, I'm going to talk about addressing the need. So the opioid epidemic has really been heavily impacting Sarasota County since around 2013. And as I'm sure we all know from whatever community we're living in, Florida was hit very heavily and still is with the opioid epidemic. And this was creating a lot of significant strain on our hospital, Sarasota Memorial Hospital, which is our main hospital, but all of our medical systems, our health department, providers, physicians, independent physicians in private practice even, our behavioral health care providers, certainly our first responders, the child welfare system, and really impacting the community as a whole. More people in Florida died from drug overdoses in 2016 than in any other year on record. And the majority of those overdoses involved an opioid. And since 2013, the number of heroin overdoses in Sarasota County has quadrupled, and the rate of fatal opioid overdoses grew 300% in 2017 over 2016. And this was really due primarily to the introduction of more deadly synthetic opioids like fentanyl. And when fentanyl hit the street and was getting mixed with the opioids, the death rate just went incredibly high, and really was affecting and putting a lot of strain and stress on our first responders, but on the hospital systems, and again, all of those systems we just talked about. So according to the Florida Department of Children and Families, the Office of Child Welfare, Sarasota County had the second highest child home removal rate in the state. And opioid abuse is the #1 reason for child removal from the home in Sarasota County, as it is pretty much throughout the state of Florida and our nation, accounting for an average of 21 cases of child home removals per month. So that was putting a tremendous amount of strain on our foster care system, on our foster parents, who were being asked to take additional babies. Almost all of them were opioid affected babies, and putting a strain on, as I said, every single system that was involved. And Sarasota County also has the 3rd highest percentage of babies born with neonatal abstinence syndrome in the state. So the problem, there were tremendous challenges in managing opioid addiction during pregnancy. And there were a lot of different opinions of people in the community about how pregnant women should be treated if they had an opioid addiction. So the problem in 2017 is that the Sarasota County programs and systems were really pretty much working in silos and really not talking respectfully with one another, because there were so many different opinions about how to address this challenge. An increasing number of babies were being monitored for NAS, neonatal abstinence syndrome, were being treated for NAS at our hospital, and with a prolonged length of stay at our hospital from 2005 really until about 2016. So there was increasing substance use in our pregnant patients in our community, many of them, some seeking no prenatal treatment because of fear and because of stigma. And or there was intermittent prenatal care. They were being seen at the health department and the hospital in Sarasota County. And Sarasota County Memorial Hospital really also serves a lot of patients from DeSoto County and sometimes even from Manatee County. And so we saw increasing deaths in pregnant patients and increasing bias against these patients, which was making it even much more difficult to see them and to be able to treat them. And then there was also a lack of communication between available services among agencies and of services available to Sarasota County pregnant patients. And we really found that when we came together and we looked at the gaps, there were really some significant gaps in services in our community that needed to be created to address these issues and these challenges. So our question as a community in early 2017 was posed by a group of these 4 people that you see at the bottom, and spearheaded by Dr. Washington Clark Hill, who is a phenomenal OBGYN and has been the chief OBGYN at Sarasota Memorial Hospital, and he is now with the health department. And he says he retired like several years ago, but he really didn't retire. He's sort of like me. I said I retired last year, and here I am kind of still working because we have passion for this and we can't leave it. So the question came, and PJ Brooks, who you see on the slide, his name is on the slide, was working at First Step, which is our community's primary behavioral health provider in Sarasota County. And we were really perplexed as a community and said, what can we do? Can we safely do something different for healthier moms and babies? And that was the question that was really posed to the community in 2017, that we all had to come together and kind of put our heads around and figure out how we were going to address this very significant challenge that was impacting our entire community. So as I said, this initiative was begun and spearheaded by Dr. Washington Hill, a hospital physician and practicing OBGYN and maternal fetal medicine. And the purpose of the initiative, and I remember being at the very first ASAP meeting that Dr. Hill called, and there were probably around 14 or 15 of us sitting around the table, kind of putting our heads together, trying to even identify specifically what the problem was. And that's a challenge. That you would think that, well, we can easily identify the problem, but everybody sort of had their own take and their own spin on what the problem was. And there was finger pointing going on among the agencies. And we certainly were not at that point in the very beginning at a place of coming together and collaborating and finding a solution for this. But that's a part of the process of coming together as a community, is stepping in where you are and identifying the place that you're in and then working from there. And with the commitment that we're going to see this through. And Dr. Hill really drove that commitment. He's a very, very passionate guy. And he said, we're all coming at this with our own lens from whatever field we might work in. But we all have to come in here together with one hat, and that is to make this a better community for our pregnant patients and for their babies, And we all need to do that together because every single service and every single provider is needed in order to make this happen. And so the purpose of the initiative was to bring the community stakeholders together, and we realized there were people missing from the table. And that was part of probably the first 3 or 4 meetings we kept asking, and still today, at these meetings, Dr. Hill will say, who's missing from the table? And often now, there's like 50 people at the table when we have these meetings. So we're like, who's missing? But that's a question that we keep asking ourselves. Is there anyone else who needs to be at the table? And now, and it was too long in coming, we now have pregnant women at the table. We have women who are still using at the table, who have given birth to children, but who are in treatment. And they are a vital voice to how we see them, how we view them, how they view us, and a sense of trust has been developed that was not there in 2017. So it was really to bring these stakeholders together to develop a successful integrated model of care for pregnant women using substances and their newborns. And so again, Sarasota Memorial Hospital, community partners and providers serving pregnant women with substance use disorders, and patients and their newborn children were invited to form a comprehensive collaborative care team, what we called our CCCT, which then led to our Addiction Support in Pregnancy, or ASAP program. I was at the table as the CEO of the Florida Center for Early Childhood. And you might say, well, you know, why were you there? You're with early childhood. And yes, but our agency also had the Healthy Families Program. And I'm sure you're all aware of the statewide Healthy Families Program. So many of these women, either while they were pregnant or shortly after giving birth, were at such high risk of having their children removed and placed in child welfare that they entered the Healthy Families Program. So we were very much involved from that perspective, but also from the perspective that we treat young babies and children and their families, and from a mental health perspective, and also developmental therapy services, which many of these children need. And we work very collaboratively with Early Steps, our early intervention program. So everybody, people who thought they didn't have a seat at the table, really had to reevaluate, do I belong at the table, and what can I bring? Even if I don't have a service that I can provide, what can I bring from my background, or from what I do now, or from my advocacy position? What can I bring to the table that would be a valuable voice to this initiative? And I have to say, there was, within a very short period of time, incredible buy-in from the community. Everyone involved, we involved everyone who touched the patients in our community, and began to develop this very comprehensive model for addiction support in pregnancy. We used a coordinated multidisciplinary approach, so that, we had providers from, medical backgrounds in mental health and child welfare, and just a whole multidisciplinary approach. And it was to advocate for comprehensive and collaborative care at all levels, and to bring all available resources to patients. And that was patient awareness. A lot of that was patient awareness. Patients didn't know where to go and how to seek help, or they were out of fear. They just would not do it. And the stigma that would be that they knew was there with them, and the bias. And then it was to bring patients to all resources and have access to all resources. So for many of our women, that involved transportation. And they might have known about the service, but they had no means of getting to the service. So we really had to work around, how are we going to bring these resources to the patients and bring the patients to the resources. So that was probably just 2 or 3 brainstorming sessions in itself. And the transportation issue is one of the toughest challenges that our women face. And so we had to get creative about that with giving gas cards. Some of them just didn't even have money to buy gas to put in their car, if they had a car, and bus passes. And we also used Uber for many of the patients to be able to get them to services. So a lot of, we say out of the box thinking, but it really was out of the box thinking about what we can do and how can we also get the funds to help us support what it is that we want to do. So we cross the usual boundaries of community and clinical care to benefit the patients and the neonate. And that, again, you have to keep your eye on the prize. That was the mission, that was the goal. And if anybody started to veer off of that, Dr. Hill was right there with his almost whip, getting people back in line and saying, remember why we're here at the table. And it really takes that sort of leadership in a community to drive this kind of an initiative. So these are all of the different agencies that partnered together to form ASAP. We still meet monthly, and that's been going on for years now, since 2017. And there's still much to talk about, and there's still challenges to overcome, and there's still different ways of thinking about doing things. And so as you can see, there are a lot of different players here at the table, and including our Sarasota County Sheriff's Department. And because they're heavily involved, they're first responders. They were often bringing the patients into the hospitals when they were getting the calls. And we really had to also make sure that we were inviting our private OBGYNs because they were doing a lot of treatment in our community. Lots of mothers and infants programs, so that we made sure that when moms were released from the hospital, it wasn't just what was happening in the hospital, but really having to make sure that, once they leave the hospital, how are we supporting them? How are we supporting them to be sure that their children don't get removed from them and placed into the child welfare system? And that takes a lot of work and planning and a lot of parent education, really, in the homes. Healthy Families is like one of the most wonderful programs in the world, because we have our family support workers in the homes every single week, helping moms and supporting moms and teaching and modeling and being right there as their sort of go-to person if they're in need of help, and linking them with other resources as needed. So lots of players at the table. And this is just a picture of one of our earlier meetings. And you see a lot of white coats in the room. Those were all medical staff. We held the meetings at the hospital to make it more easily, accessible for the medical personnel to be able to get to the meetings. And this was one of our smaller meetings. I think this was taken at one of our beginning meetings. Now, as I said, we've had to move to a bigger room with a bigger table and a lot more chairs around the room, but this is one of our early meetings. So supports and services provided to patients through ASAP. There's a peer support group, which is incredibly important and was something that was missing in the beginning. Medication assisted treatment, that was in the initial stages of this. There was a lot of bias towards medication assisted treatment, and there were different medication assisted treatment providers. One was in Manatee County that was doing a lot of the work, and then First Step in Sarasota, and even they weren't on the same page about how we should approach treating pregnant women. So making sure that they were coming together, we were all on the same page about what the plan was going to be. And then this excellent team of providers, again, the cross-disciplinary providers. We had level 3 NICU because the NICU unit was heavily involved with especially the NAS babies, and then breastfeeding and education, because that became a vital part of helping the maternal infant bonding process. And there was even, a lot of conflict around whether women should breastfeed or not breastfeed if they're still using an opioid to help them safely through their addiction process. So lots of discussion and lots of planning had to take place. One of the most important things that had to be done was this judgment-free, coordinated, collaborative care. And I have to tell you, that took a lot of work, and a lot of that work had to be worked through with the medical staff. And because they were seeing, you know, that in the NICU, they were seeing these babies so highly affected every single day. They were dying. The pregnant women were dying. So, you know, they were experiencing firsthand the loss and the grief that was taking place as a result of all of this. And they were exhausted because the system was overburdened and overworked. And so really kind of working through, and our mental health providers and substance abuse providers were very, very helpful in working with the medical staff and in having them understand that it's a disease. And there's no woman, I have never met a woman who intentionally wanted to harm her child while she was pregnant. Never, ever, ever. And really helping them to develop more empathy and less judgment toward the women who were coming in and who they were seeing and treating. We wanted it to be all inclusive, and we wanted to learn from one another through presentations and data, and that is exactly what we did. I learned a lot that I did not know from just different presentations from some of our substance abuse providers, but also our medical personnel. We were collecting a lot of data. The hospital was gathering that data. And then meeting with other community agencies with similar goals. And there were, as I said in the beginning, there were a lot of agencies that were working, but we weren't on the same page. And we didn't all necessarily have the same goals. So bringing those, you know, sort of outliers in that were not at the table yet and helping them to understand how valuable they were and how they needed to be at the table. So we had a coordinated, and I just, you know, coordinated and collaborative. That CCC, coordinated collaborative care, is not easy to do, and but it's so important to do. So some of the benefits and successes of this community collaboration, Planned Parenthood now goes to the medication-assisted treatment, or our MAT clinics, so that they are there talking to patients about, you know, planning their pregnancies and making them aware of the services of Planned Parenthood. And again, that's that part of bringing the service to the patient. And Planned Parenthood didn't do that before. So this was a different and a new outcome, and that we hadn't even really thought about initially, but has been a very, very beneficial one. Immediate postpartum as in a intrauterine device or a long-acting reversible contraception to decrease pregnancies while on drugs. And our pregnant women, after they gave birth, they were very, very receptive to this. They didn't know how to access these services prior to their pregnancies, or they didn't know about them, or they were fearful to go in because they were afraid they would be reported. And also now there's been since I think it started in 2017, we now have an annual regional summit on the opioid addicted pregnant patient, which is wonderful. And last year's was virtual because of COVID. And this year's was live again. So we have a huge turnout. Every single year that we've held this, we have a lot of different presentations on different topics. And it's been very well received by our community and supported. And I didn't address this in the slide, but it's really important to say that our community funders have really come on board to support the work of ASAP. And that's our Community Foundation of Sarasota County, the Charles and Marjorie Baranczyk Family Foundation, the Gulf Coast Community Foundation. These are your community foundations have to be at the table when you want to try to do some of these things, because you need their buy-in, and you certainly need their funding support. And this is what they want to do. This is why we have community foundations. So, and they help to fund and support the regional summit. So make sure that, you know, they're a partner in the player there. I didn't have them at the table on that other slide, but they have definitely been at the table. And very much connected with sort of an outgrowth of what happened here, which I'll talk about a little bit later. And then drug court was established, and drug court is a problem-solving court. It's a specialized court in the state of Florida We have a wonderful judge who is over our drug court, whose wife is a psychologist. Actually, she's a social worker. And he was actually on the board of the Florida Center for Early Childhood. So he gets it and he understands addiction as a disease, and he is not punitive, he's supportive. He gives them choices for treatment. He treats them, you know, I've sat in his courtroom and it's just amazing the respect that he shows for these women, and just the true value that he places on them. So drug court has been an important part of this initiative. And also now we have early childhood court that's become more of a part of this initiative. So babies monitored for NAS requiring medication, an average LOS or length of stay is trending down. Our regional summits, which I talked about. And we have an educational brochure with information on the program. We now set up tours for pregnant women to come and see the hospital, to see the NICU, to kind of meet with the nurses and understand what the process will be like for them, so their fear is reduced and there's a sense of trust before they come in to deliver their baby, and then a support group to help support them through this process. And that has been a very tight collaboration between First Step and our hospital. But also community providers come in to be a part of these tours sometimes, and to talk with the women, to let them know about early childhood court, if their baby would be removed at the time of birth, that's not the end all be all. We've got this early childhood court program that can help them work toward having their babies returned. So lots of things came out of this initiative and are still continuing. We just see no end in sight to what we can do. This is the brochure that I talked about, and it's this is too small, I know, for you to be able to see, but it's a trifold brochure that women get when they come through to take a tour of the hospital. We now have these out in all agencies, and so that women have access to them. They're in the health department. Our Healthy Families program has them. So, and this took a lot of work by all of us to kind of put this brochure together. And this is not available yet as a link. I think they're working on that as we speak today to try to create a link. And I'll make sure that I send that to Rebecca and Cynthia to get that out to you. I do have this as a PDF though, so if anyone would like to, because it's really hard to kind of read this, if anyone would like to have this as a PDF, just please let me know and I will make sure to send it to you, because there's a lot of, and I don't believe in reinventing the wheel at all. If you can take this and it can be helpful and useful to you and your community, you know, please use it and adapt it to however it works for you. But on the front cover, it's the addiction support in pregnancy, what the program is, and then looking for help during pregnancy. Don't be afraid to ask. And that phrase, don't be afraid to ask, was very intentionally chosen because that was the comment that we heard from a great many of the pregnant patients, or the physicians heard. I was afraid to ask. So don't be afraid to ask for help, and to know that we are all here as a community to support you without judgment and without bias. And then all of the different services that can be available to women, how they can get a tour, an obstetrical tour at the hospital when those tours occur, and information about the support group. So a lot of good information being given to our pregnant patients, and they are absolutely taking advantage of it. The participation rate has greatly increased since the beginning of the initiative. So some of the next steps for ASAP, short term, make a part of 1,000 Days of Sarasota initiative and collaborate with all agencies who touch these patients and their children. And First 1,000 Days is an initiative that kind of came from the development and the work of ASAP. And ASAP really does that initial work of making sure that the babies and the moms are safe during pregnancy and in the postnatal period. And then once they're discharged from the hospital, then what? And that's where we said there's a huge gap in our community. And how are we going to address that? And what are we going to do about that? And so the Charles and Marjorie Baranczyk Foundation came on board and became a part of the First 1,000 Days initiative that we have going on in the state of Florida. It's a national initiative, and created the First 1,000 Days of Sarasota County. And that's a major collaboration of agencies who touch these patients and their children, pushing the collaborative care model nationwide. And then long term, just making sure that we have safe medical detoxification with behavioral health during pregnancy in selected motivated patients. And that's a screening process that involves a number of people from the hospital and the treatment providers. And that last bullet, it's a shared decision model. And again, that's everyone coming to the table with their voices, it being heard in a very respectful manner. And making sure that whatever decision is made at the end of the day, it's a decision everyone can live with. And then it's evaluating. It's not a linear process at all, as you all know. It's a circular process. And so you always evaluate and you adjust as you continue to go. And if changes need to be made, then those changes are made, and you just continue to grow and develop in the model. And every time you do that, things just become better for the patient. And if things are becoming better for the patient and then the newborn, then things are becoming better for the entire community. So results from ASAP from 2019 to 2020, Sarasota Memorial Hospital has significantly changed its protocol in 2019 in how it treats babies born with NAS as a result of the hospital's participation in ASAP. And as a result of these changes, infants born with NAS are needing fewer drugs and staying less time in the hospital. That length of stay is being reduced. Morphine is still used to treat newborns with NAS, but the hospital has raised its threshold for when the drug is prescribed and has lowered its dosage. And phenobarbital has been replaced with clonidine as a secondary drug. So lots of changes took place, and these were not easy changes within the hospital culture. Nothing is easy when you have these kinds of very difficult questions and challenges that are taking place. But it's that collaborative community coming together that says we can work through this. And, let's take a look at some of the results that we're getting and continue to push in the direction that is going to be most beneficial for this pregnant patient and for her newborn child. And so those are some of the amazing results that have taken place. And again, practice has also changed to improve maternal-infant bonding. The hospital is now encouraging breastfeeding, more time together in the room, in more skin-to-skin contact as much as possible. And that's been an incredible cultural change within the NICU, but also in the hospital in general. And a lot of working through with the medical personnel to have them see the benefits of the skin-to-skin contact and mom being an asset to her baby and not harmful to her baby. There is more concerted effort to connect mothers to resources following discharge, like our Healthy Start program and our Healthy Families program. Healthy Start and Healthy Families now has a worker that goes over to the hospital weekly to meet with families that might want to get more information or might just want to have a conversation about what their services can provide. And the goal then, again, is to pool community resources to support mothers with substance use disorders through treatment services, recovery support groups, and peer support, and prevent them from relapse. removal of their infant, or falling through the cracks. And we all know that relapse is a very real thing, and it's a part of the process. And we often, you know, the plan was before, if moms relapse, their babies were removed. Well, we're working really hard now that even if there's a relapse, and this is through early childhood court, that there's not an automatic removal. And this is through the provider agencies, that we help moms work through that relapse, get them back on track, and keep them connected to their infant. And I don't think it's surprising to know that the bonding with their babies and keeping their babies is the highest motivator for these moms to stay clean and to make sure that they're attending their treatment programs and their mental health sessions as well. And so that it's this safety net that the community has really created around the mom and the baby to support both of them through this time. And so the results have been, the average length of stay in 2017 was 13.4 days for the infant. And in 2019, that number reduced to 8.3 days. So you can see a significant drop in the length of stay for the newborn in the hospital, which means there's more bonding time with mom and baby, less trauma just from being in the hospital. So we are very pleased with the results that we're seeing. So we're going to kind of shift now into talking a little bit more about another collaborative that's taken place that kind of stemmed off of the first of ASAP, and that's our First 1,000 Days Suncoast Initiative. But I think I'll pause here before we shift here and just see if there are any questions in the chat. And I don't see any that have popped in here. And Rebecca, if you see any questions, if you could help me with that, but I don't think I see any.
I don't have any on my end.
Okay, super. All right, then we are just going to move right along here. And a lot of the partners that were at the table for the ASAP initiative are also at the table for the First 1,000 Days Suncoast Initiative. And that has been going on for several years now. And it's the Charles and Marjorie Baranczyk Foundation, as I said, is the spirit takes the lead in our community on the First 1,000 Days Suncoast. And our motto is 75 community leaders, one shared purpose. So again, that coordinated collaborative effort is what's needed. And now we're addressing our objective 2. So First 1,000 Days Suncoast is a collaborative effort to give our most vulnerable neighbors the supports they need. And it's by pulling together our partners and our resources. Again, this initiative will provide better access to the prenatal, the newborn, and early childhood developmental care that gives babies and families a crucial opportunity to thrive. And we all know, I think, that those first 1,000 days are so, so, so important. The vision of the initiative is we envision a safe, healthy, caring, and culturally sensitive community that supports families and helps newborns thrive and children to achieve their potential. Again, like I just referred to this as that big safety net that we're wrapping around them to ensure that those first years of life are of high quality and that they are protected and that they're supported and that they are given the services that they need. And the mission is to improve access and coordination of services for families and babies. And again, that goes back to making sure that they have access to the services, we can get them to the services can get to them, and that we're all working together. Because I think we all know when you're working with a pregnant or a postpartum mom who is using substances, that needs a lot of arms. That mom and that baby need a lot of arms to wrap around them, and there can be a lot of service providers involved. And what we don't want to have happen again is to go back into those silos that we were in before. We've got to stay connected and coordinated. And that's one of the reasons I really love that our Early Steps program is right on the same in the same location, on the same property as our Florida Center for Early Childhood, because there's a lot of coordination that goes on between Early Steps and our agency to make sure that those babies, even if they don't qualify for early steps or early intervention services, but they still are delayed, but not significantly enough to meet the eligibility criteria, we can refer them for developmental therapy services or evaluation to the Florida Center to make sure that there's not a gap and that they're not falling behind in those first early years of life. So that coordination is extremely important, and that is the mission of the first 1,000 days Suncoast. So why does it matter? Well, at Sarasota Memorial Hospital, more than 56% of babies are born into low-income or poverty-stricken families. And many of these babies start their lives at immense disadvantage. And actually, this was a shock to the community when we found out that 56% of the babies at Sarasota Memorial Hospital were born into low-income or poverty-stricken families. And why was that a shock to us? Well, Sarasota County is really one of the wealthiest counties in the state of Florida. We have very high socioeconomic group of folks who live here. And it's really almost like a tale of two cities. In Sarasota, you have a very wealthy population of people. And that's great because they give to the foundations and they help to support initiatives like this. But you have this very poor, community as well that needs a lot of attention and a lot of support and a lot of breaking down barriers so that this wealthy population of our community understands that we also have this pocket in our community that are not well off and that we have babies being born that are being born into poverty. And I just saw a question pop up, what about the dad? That's a very important question. And absolutely, dads are involved in this process every step of the way, or partners. Or, if there's a significant person, man, in that mother's life or that pregnant patient's life that she wants involved, we absolutely want them to be involved. Their influence on the pregnant woman, on the pregnant patient can be very heavy. And that can be a negative influence or it can be a positive influence. And we want that to be a positive influence. So they are invited to be a part of the support group. They're invited to the tours of the hospital. If they are living in the home when these babies go home, we really ask that they're a part of the treatment plan. And so, yes, dads and the men and the partners are not ignored at all. They are very encouraged to be in the hospital, to be in the NICU, to be there, and to support the mom and the baby in a very healthy way. So many of our families, you're great. Thank you for asking the question. Families often lack stable housing, food, healthcare, and other resources that we know are key to babies' foundational, physical, emotional, and intellectual development. And the first 1,000 days Suncoast partners are working together to create this continuum of care that will meet the comprehensive needs of our families. One of the most important partners that's been at the table and has really become a primary partner at the table is our food bank. And a lot of support from our foundations has been given to the food bank and Sarasota County government, because they have become critical to help meet the food needs of our families. And so when you think, well, maybe that partner really isn't significant. There's a seat for everyone at the table, and everybody at the table has a purpose. So the food bank became one of our most critical partners, especially during this time of COVID, because it's been so hard for families to get out to the grocery store or to get food or to have the financial resources in order to be able to do that. So there's drop off of food to our families if that's what's necessary. It's really saying, what do they need and how can we reach them? So And I think, I don't know if you are all familiar with the ALICE report that's done by United Way. I would encourage you to Google that. But our ALICE report for our Suncoast region, we have a very high number of families with food insecurity and economic insecurity. So that's why we have to, bring in all of these people, all of these community connectors to make sure that we're getting the resources to our families. So why 1,000 days? Well, from the third trimester of pregnancy through baby's second birthday, human brains undergo a period of very rapid growth. And during the first 1,000 days of life, children are hardwired, their brains are hardwired in ways that have lifelong consequences. And fortunately, children are resilient if they have the supports to help them thrive. Babies who have health care, who have good nutrition, who have stable homes and loving relationships, and in early childhood education, start life with a strong foundation for success. And there is a lot of research that's been done to support this. But if we don't catch them early during this first 1,000 days, their prognosis and their trajectory is not nearly as hopeful or as optimistic as if we can get them and reach them in these first 1,000 days. And that's why I have always been in the field of early childhood and stay committed to early childhood, because it is such an opportunity to change the entire lives of families and from generation to generation. So that's why 1,000 days, and that's why this initiative of First 1,000 Days developed nationally and has been strong in the state of Florida and is strong in our community. So solution, again, we all came to the table for a community solution, again, spearheaded by the Charles and Marjorie Barancik Foundation. And it's to build a navigable, supportive network for families and improve infant, child, and family health and well-being. And the First 1,000 Days Suncoast devised a blended framework with 5 key components, all independently grounded in science and/or guided by the community, parent, and stakeholder input. If successful, women will have access to prenatal care and supportive services for healthier pregnancies. Families and children will be healthier and more resilient, and health inequities in pregnant women, infants, and children in our region will be reduced. That's the goal, and that's the solution to the problems that we're facing in our community. And there's been great strides that have been made since the initiative started, and there's still a road to walk down to get it to where we all want it to be. I know this is a hard diagram to see, but this is sort of the navigational path. And I did list this as a resource or reference in the handout. And you can go on the Charles and Marjorie Barancik Foundation website, and you can see this a lot more clearly. But you will see how we've got the pregnant woman down there in the corner, and then this navigational system that's really been set up for her to meet her where she is and to make sure that all of the services and supports are in place for her throughout the remainder of her pregnancy, through her time in the hospital, and then through her time after she either goes home with her baby, and hopefully that's the outcome that we are wanting to see, or if her baby is removed, to make sure that there's no break in that connection and that all of the partners are involved and that there's coordination around her. There's a patient portal that's been developed so that there's a tracking system and a coordinated patient navigator to support her that has been funded through the Marjorie and through the Barancik Foundation. That's continued. And those folks are placed in the hospital to make sure that that coordination continues for that woman and that she knows she's got that support as she's staying in the hospital and after she's just discharged from the hospital, both for her and for her baby. So some of the key components are the integrative activities, the partner collaboration that we've talked about, and the innovation, the parent empowerment that we talked about. And the parent empowerment is just so important, because these parents don't feel empowered. They feel they feel that there is a bias and stigma, which we know is true. But this is a way to help them feel empowered and to help them begin to learn how to advocate for themselves and to become advocates for their babies and for their children. And I think that's a very powerful component of this. And hearing some of the parent testimonies, and I did try to get a tape of a parent testimony, and I wasn't able to do that, but hearing the parent testimonies when they come to some of the meetings or they speak at one of our conferences is just, it seriously makes you cry, because they will talk about, you know, what their lives were like before, and then what their lives are like now, and how through the work of ASAP and now the first 1,000 Day Suncoast, they feel loved. That's the word they use. They feel loved. And sometimes for them, that's the first time in their lives. These are generally, many of these women did not have the kind of early childhood or childhood at all that we would have hoped for them and for everyone. And so it's been an important, and also for dads and, you know, for partners, we want to make sure that, you know, they feel empowered. And somebody asked a question, are there specific services for the dads? Yes, there is. With we have through our Head Start program at Children First here, we have the Nurturing Dads program, which is a very strong component. They are definitely at the table and engage dads in support groups. There can be individual treatment for them if that's what's needed, or from one of our community providers. But the Nurturing Dads program is an evidence-based program, and that's very powerful for men who have been involved in that. So making sure that whatever the needs are, or however we can empower our parents or partners to seek resources, to ask for help, to learn to advocate for themselves. And the amazing thing is they often become the strongest advocate for their children. And they'll, you know, and that advocacy component, that empowerment component carries with them even after early childhood. I've seen it, you know, in IEP meetings where they were a part of this program, and now their child is, you know, getting referred for IEP services, and they're the strongest advocates at the table advocating for these services. So that parent empowerment is a very critical key component. The care coordination, and then the very targeted interventions and services. So I think we're going to take our break right now. It's 10, I'm reading 10:59. So let's take a 5-minute break. Rebecca, you can help put our break sign up. I know 5 minutes is not long, but let's just take a breather. And we will be back in 5 minutes to continue our program for today.
All right, everyone, we'll meet back at 11:03.
Rebecca, are you there?
Hello, everyone, and welcome back to today's webinar. Ms. Shea, if you are ready, I will pass the presentation back over to you.
Great. I hope that was a restful 5 minutes for folks. I know it was a short 5 minutes, but I hope it was a good break for you. So we are going to pick up and finish our webinar presentation in our next hour. And we will talk about the 2021 results of the first 1,000 days Suncoast. So a coordination of partner organizations to present at community pediatricians bi-monthly meetings to increase awareness of social and mental health services and initiatives are available for families. And we have here for youth, First Step of Sarasota, and many other partner organizations that come together. We have sort of a list of who's going to present at the pediatricians' bi-monthly meetings. And the pediatricians have really benefited from these presentations of services in our community. And the majority of them would say they had no idea that all of these services existed for families and are now. And you all know, I know, that pediatricians are that first line of defense for families, for babies. They're the first person that really gets involved in the baby's life after they are born. So making sure that pediatricians are aware of what's available in our community, that they know where the resources are, that they can get a hold of the care coordinators. And so them having that awareness, and you would think, boy, why didn't we do this 100 years ago? Well, because it was just one of those things that we never really thought about. But those are the kind of things that happen spontaneously when you come together and talk about what's missing. And we all then realized, well, where are the pediatricians at the table? And it's hard to get them at the table because they're in their offices all day working. So us going to them for their bi-monthly meetings was a way to break through that barrier so that we could make them more aware of where they could refer their patients. So plans for a region-wide trauma training for community partners was delivered by Resilient Retreat. Those were things that happened last year. And this will create a more standardized approach within our network to addressing trauma. And we really are working as a community to become a trauma-informed community with everyone who sees everyone in our community through those lenses. Then that really is very helpful for the entire community. And I think we all know about that trauma lens, and that trauma lens is not asking the question, what's wrong with you, but what's happened to you. And that is a whole different reframe when you're talking and working with pregnant women who are using substances and their children. So from the front office clerks to support staff to providers and executives, it is the key that all professionals working with families are trauma informed. And the Barancik Foundation, again, has taken a major lead in this and really kind of brought on the other foundations to see how important this issue is in our community. And that if we have healthier families and healthier people, we're going to have a healthier community. And so there's been great buy-in on that. So some of the other results, we launched the Color the Community campaign to increase awareness of the basic principles and initiatives parent portal website. And that's on the First 1000 Days webpage, or in Spanish, you can see the link there. And that's really, they've done a great job at really having the community become aware of what the parent portal is and how to access that. And it's been incredibly optimistic for families and for providers as well. Continued the development of the plan of safe care for substance exposed newborns and their families. And I'm going to be doing a webinar in December. I think that date is December the 9th, but don't quote me on that, on the plan of safe care and what that, again, this, as a result of the first 1,000 days, they have put together an incredible plan of safe care that involves so many people. And it's just become a document in the past 30 days, a finalized document that I'm going to be very excited to share with you. They've created, the collaboration has created an asset map of mental health supportive services for pregnant and postpartum women. And again, that asset mapping really takes a lot of time and effort and putting that together, but it's such an important community project and important thing to do for your community, because we all have learned about the assets. And then the collaboration also has funded the basics Insights, it's a text messaging service that sends developmental tips and activities to families twice a week. It's a data dashboard, provides a zip code, specific data on parenting behaviors to assist with any targeted interventions. And I just thought this was the most brilliant thing in the whole wide world, because all of our families have phones, they all have text, and this is a way to get information to them that can be very important to them. The families have found it incredibly useful. They look for these text messages and they are benefiting, and so are their children, from these developmental tips and activities. Plus, it's bringing them closer together. Again, we really, all of us, in wrapping this safety net around these families, and we want to make sure that we're building that relationship between the parent and the child. We know relationship is so critical to healthy child development and early brain development. So when we provide these activities and these tips, and the families engage in them, and they engage in them with their babies, that we're really helping to promote that maternal infant bonding. So incredible strategies have been developed here. We've created community murals that have been painted by local artists that celebrate families and spread awareness about the initiative. And some of these murals are just amazingly beautiful. And some of the murals, the artists have also worked with the families to create the murals, so they've been involved in this. Again, the All Faiths Food Bank, it takes on that local role as a coordination center for the Unite Us Care coordination platform. The Unite Us Care coordination is a platform that was brought into our community by the First 1000 Days Suncoast, where anybody who's asking for, it's sort of like 211 is with United Way, but a sort of a faster response to responding to the initiative's assistance request forms. So again, that collaborative effort to bring everyone together to the table and to see how we can best access our resources, utilize our resources, and most importantly, get our resources to our families and our families to our resources. So 68 community organizations now use the countywide care coordination platform, Unite Us, to send medical and mental health and social services throughout the community. So far, over 1,000 referrals have been made, with over 600 sent from Sarasota Memorial Hospital alone. So you can see how effective just having a platform like Unite Us can be to a community to get services linked to families. And that's what that's what the intention is, to make sure that those connections happen and that those referrals are followed up on, and that there's an end in sight for our families and our children to be able to get the help and the support that they need. So we're going to now shift in for the remainder of the time that we have to talk about some of the common barriers faced by pregnant and postpartum women with opioid use disorder. And this is our third objective. And I think that, we all, probably from our own fields of what we do in the work around this, we all have been able to, I certainly have in my 40 years of doing this sort of work, seen more barriers than I would ever want to see that really are pregnant and postpartum women with opioid use disorder face all the time. And I think we're all committed to doing whatever we can to make sure that we are breaking down these barriers in whatever way we possibly can be a part of. And that's why these community collaboratives and these collaborations are so important, because you can't do it alone as a single agency. I can tell you that. We tried. Oh, sorry, that's my doggy barking. They're cutting the lawn and she just does not like that. Let her out. Hold on 1 second.
sorry about that. She thinks she's so mighty, and she's not, but she pretends she is when they're cutting the lawn. So back to the barriers. I think we've all seen these barriers. No one agency can break down these barriers. And it does take this, it takes a community coming together with all of our assets and our resources, and having the desire, having the will, the community will, if you will, to say, this is an issue in our community. We can't ignore it. We can't pretend it doesn't happen, that it's not here. We can't just blame the women who are using opioids for this problem. It's a community problem. It's a community issue, and we have to support these women and their babies that are facing these huge, huge challenges and dilemmas. So research indicates that there are many barriers that are faced by pregnant and postpartum women. And I've listed just some of them here, but there are some references and resources available to you on here that you can check out more. And, you know, ask the women themselves. We did that as a part of trying to break through the barriers. There, the first 1,000 days in ASAP held focus groups with many of the patients to say, what's your biggest barrier? And there were so many barriers that it was, you know, kind of hard to say which one are we going to tackle first, and then second, and then third, because you can't tackle them all at the same time. And that process is still in place because, as I said, COVID has created barriers that none of us could have ever predicted, and has made it much more challenging. And we all know, I'm pretty sure, that substance use has gone up dramatically since COVID came, as well as mental health issues. And so it's brought on a whole new level of challenge in every community that we had not anticipated. But I sit here now presenting this to you saying, I am so thankful that Sarasota County did what we did when we did it, because now these services are in place. It's not like we're starting from scratch and scrambling to say, oh my God, we have these huge, you know, we've got COVID, we've got all these huge issues. What are we going to do? We've got some really great things in place already that we can continue to build on or expand on. So some of the barriers that women have said are fear of child protective services and possible removal of their baby or child from their care. That has been indicated as one of the top barriers in a lot of research that's been done. And that's why women often, when they are pregnant and they're using, will not seek prenatal care because they're afraid they're going to get reported and that their child will be removed as soon as it's born. So breaking through that barrier to say, we're here to help you, we're here to support you and your baby. And then that's a double whammy. If that baby has not received good prenatal care throughout that time of fetal development, that puts them further at risk. So making sure the Child Protective Services is at the table, and in our community they are, and they have rules and responsibilities that they have to follow, but we also have the great advantage of having a strong early childhood court. And so again, it's bringing everybody with maybe opposing views and working through what the issues are. Identifying treatment programs and completing admission requirements has been a major barrier for women. Sometimes wait times, you know, if a woman is ready to seek treatment and she is told that, you know, it's going to be 2 months before she can get in, that's not going to work. So being able to have the capacity within your community and your treatment centers to be able to get those services in place quickly. And also what PJ has said to me many times from First Step is that you can't just give them a referral and tell them to call and expect that that's going to happen. You really have to hold their hand. You have to walk them through that. And I think we all know, if any of us have filled out applications for anything, it can be just such a daunting process to just do that. So having that parent navigator help them through that has been incredibly helpful. The counselor's ability to address women-centered issues has been a barrier. The fear, the safety, and the stigma, again, associated with being pregnant and with using substances is a major, major barrier. So again, that fear, safety, and stigma, transportation, which I talked about, is a major barrier for women. And that is not an easy barrier really to overcome. We don't have a great public transportation system here in Sarasota County. And so trying to come up with some other creative ideas like using Uber and being able to have the funds to pay for that, or bus passes, or whatever it might take to get the woman and her husband, her partner, or her baby to the pediatrician even, is critically important. And then a lack of support or positive reinforcement from partner or family members to attend treatment. And that was listed probably as one of the top 10 that I've seen in the research as a barrier. And it often came from a partner that they just did not want the pregnant woman to attend to attend treatment. And so having that support, and that's why it's very important to bring in partners and family members as a part of that treatment component, if you will, if they're going to be involved in the pregnant woman's life or in her life after the baby is born. So some of the main ways that were found to address these barriers were to reinforce women's personal motivation for treatment was a facilitator. Suggestions to improve treatment programs included, this sounds so simple and yet it isn't being done in a lot of treatment centers, but to allow children to accompany their mothers. And as an infant parent specialist, that's why wouldn't we do that? Because we're working on the relationship. And then involvement of peer support, and peer support is so critically important. And women have said that over and over again. And only women programs, or women only programs. Women who are going through this want to be with other women who are going through this. And it's a whole different set of issues for men than it is for pregnant women, pregnant substance using women. So those are some of the suggestions and the comments that women themselves have made to us, and we need to pay attention to what they're telling us and make sure that we're creating those things that will help to break down these kinds of barriers. So right now we're going to take just 5 minutes, I think, and I hate that we can't be in a large group doing a webinar, but we're going to do with what we've got. And what I want you to do right now is to, in your chat box, and Rebecca's going to help me to keep track of these, but in your chat box, list at least one barrier that you have seen that maybe we haven't even listed here, or one that has been listed, and then one strategy that your community has come up with or could come up with to address that barrier. And we are going to take 5 minutes to do that, and it is 11:23. So at 11:28, we will come back and do a little bit of sharing from the chat box. All right. Well, it looks like we've got a lot of chatting in the chat box and some really great responses. So I'm just going to go through a couple of these. Lack of social support to help connect mom, mother and baby with other mothers and support groups. Absolutely. Transportation. Yes, yes, and yes. Lack of social support, boy, that keeps coming up again. And let's see here. A barrier, finding an OBGYN that will work with patients receiving Medicaid-assisted treatment. Yes. Transportation, we received limited one-day bus passes for appointments to help. So again, creatively thinking about, how to do that. Not having enough resources to help. Let's see. Childcare at collaborative meetings due to crying babies. Oh boy. Yes. And that's, we wouldn't really think necessarily that was something that might keep moms away. But yes, let's do that. We can bring in childcare workers or make sure that that's available when we're setting up these kinds of meetings. So information on Dial a Ride. Oh, I don't know about Dial a Ride. We use Uber here, and maybe Dial a Ride is something that that would be another resource for communities. And then I see there's been a lot of training about Narcan and how to obtain it. Yes, absolutely, positively. That's been literally a lifesaver. And many of these mothers did not receive prenatal care, and it's been challenging getting them seen by an OBGYN for postpartum care. And so it sounds like we're all facing, wherever we live, we're seeing the same sort of barriers. Shame, I see shame here, yes. And then only having co-ed groups due to financial issues with staff. Addressed barrier once a week. A woman therapist and male therapist changed their schedule to accommodate having at least one of the three groups being gender specific. That's very creative. Provide a list of OBGYNs who are mat friendly and knowledgeable. That's a great idea, and that would be a great resource for your community. Child care at treatment. That one is again, yes. Services for a physically disabled woman in a wheelchair. That things that we just sometimes don't even think about. And then I'll just read this one as the last one. Barriers, staff and community workers who are not well trained, experienced, or educated about the experience of substance abuse as mother. So they are more harsh and judgmental. Yes. A solution is or can be to have community workers who are empathetic and understanding and more supportive and less punitive. Amen to that. Amen and amen. These are all really great responses and ideas. I do see a question here. Did Sarasota's Child Protective Services promise not to remove any child from a mother who is participating in the First 1,000 Days program or the ASAP program? No. And they can't promise that because they have federal laws and state laws that they have to abide from. But they're part of the collaborative discussion. And but it is their call as to whether or not the baby's going to be removed. And that's based on a number of factors. But I can tell you one thing that has happened is there has sort of happened that if a mother has had several children removed or even termination of parental rights on some children, and then this baby is coming, it's been almost an automatic removal that this baby will be removed at birth if mom has had TPRs done in the past. And that is not the strategy anymore. This baby is a different opportunity. It's a different chance. We have more services in place. We have early childhood court if the baby does have to be removed. But it's not an automatic removal. And now that we've got all of these wraparound services and supports in place, I would absolutely have to say child welfare has has, and I can probably get those removal rates, and I would bet that they've reduced since we put these things in place. Because they know that the baby's not going home and not being watched or protected or cared for, because all of these services are going to be seeing the mom, they're going to be seeing the baby, they're going to be watching for them, and they have eyes on and call if a call needs to be made. So no, they can't make that kind of promise, but they are at the table. And again, they have the final call on that, but we're all there to help, even if the baby is removed. So that's a great question, though. Thank you for that. And let's keep moving. Boy, this time has gone really fast this morning, at least for me. We're going to watch a video now of common barriers. We have a couple of videos I want you to see. The first one is common barriers that are faced by pregnant and postpartum women. And this is a relatively new study that shows pregnant women face barriers to accessing opioid addiction treatment. And thank you, Eric, for getting that up for us. And let's watch this video. Okay, I just thought that was a very interesting perspective, and again, a fairly new study showing hearing that from the doctor of the barriers that women are facing. So the next video that we're going to see, I can get my, oops, I have to put my little screen. This is a video of really hearing from a mother. And I think it's so important for us to make sure we hear from the women that we're working with and the challenges and the dilemmas that they go through. So this is from the words of the mom. Okay, I just think that's just such a special video to see and to hear from her how supported she felt from the team. And you see how they were bringing her the resources that she needed, like even a car seat and the gas vouchers. Those things can make all the difference in the world. But the message behind those things too is, I care for you. I care about you and I care about your baby, and we are here to support you. And what a different kind of picture that is than what we sometimes typically see. And that's women who don't have that kind of support or those kinds of resources wrapped around them. So it has to be our mission to make sure that we develop these collaborative approaches and that we are there again to see these women. You saw her pain. I mean, you clearly saw the pain that she is living with. And that's more of a burden than almost any of us could ever bear alone anyhow. And she's young. And so just making sure again that, you know, this is what we do. We wrap ourselves around them and we give them everything that they need to help them and their babies do well in life. So we are coming to the end of our webinar for today. I'm just going to, to summarize, the collaborative community approaches between substance use disorder treatment programs and community hospitals and neonatal intensive care units significantly improve the outcomes for mother and infant. And so we know this, we need to do this. And community initiatives such as ASAP and the First 1,000 Days Suncoast really do demonstrate that when communities come together to solve a community problem, and then the entire community benefits from that. And we know that changing practices in hospitals for mothers and infants produced enhanced maternal infant bonding, reduced medications for the neonatal abstinence syndrome infant, and reduced length of stay. And that's not just what we're seeing here at Sarasota Memorial Hospital, but this is research that has been found across the world, that when these practices are being put in place in hospitals, that these are the kinds of outcomes that we're seeing everywhere. So we know it works. These are the kinds of outcomes that we want to see for our mothers and babies. And so let's make it happen. And it takes time. It doesn't happen overnight. And again, it takes will. It takes the will of the community wanting to do this. But I think when we can show the community the outcomes that have been produced in other communities across the nation, that moves the needle, and we are all here to move the needle. And we also know that there are many barriers that are faced by pregnant and postpartum women with opioid use disorder. And we've learned that with creative thinking and partnerships, many of these barriers could be completely and totally eliminated. And to that, we all make our commitment. And then I just have for you a list of resources and that you can go on and you can Google, and I'm sure you all have some of your own resources as well. The National Center on Substance Abuse and Child Welfare has that's an excellent handout that is listed there. I strongly encourage you. And then the one at the top, a collaborative approach to the treatment of pregnant women with opioid use disorders by SAMHSA, is also another really, really, really good resource for you to think about and use. And now just any questions. I know we can't do these out loud, but if you have any questions, please put them in the chat. And I'm right here to answer any that you might have. Or if a question comes up for you after the webinar is over, please do not hesitate to email me. My contact information is at the end of the presentation. I will get back to you and answer you, that's I promise. So thank you again so much for being here today and for taking the time. And I think I'm actually going to let you go a few minutes early. So thank all of you for your work that you do, your investment in working with our pregnant substance using women and their babies and their partners and their families, and let's all make a commitment to make their lives better. And I know you've got my commitment to that. So I hope you have a wonderful day. It is sunny here and beautiful, and I might take off and go to the beach later this afternoon. So thank you. Thank you to the FATA team. Thank you to the Department of Children and Families for allowing me to give you this presentation today. I hope you have benefited from it and learned something new that you can take with you. And here are the references that I have used, some of their information. And there's my contact information if you like to get a hold of me, both my email address and that's my cell phone number. So I'm going to now give the presentation back to you, Rebecca, because I think you've got some parting words you would like to give to the group.
Yes, that is correct. Thank you for attending today's webinar. We have included Kathryn's contact information so that you may contact her with any future questions. Kathryn, we really thank you for all the work you put into this webinar and all the valuable information you shared with us today. Please see the chat panel for a link to today's survey. Additionally, when I conclude today's webinar, your browser will take you to an evaluation on FATA's website. If you want to receive CE credits or a statement of credit for this event, please complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE Broker for Florida licensed healthcare practitioners, you must provide an accurate Florida Department of Health license, prefix, and number the first time you register. After you register or sign in, you will be directed onward to the evaluation. You may consider using the same email address when you register for webinars through our WebEx link and when you set up your profile in FATA's system. This helps connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today. The sender will be messenger@webex.com. Please check your junk mail. Evaluations will close at midnight, Tuesday, November 23rd. We do not email statements of credit. Instead, after we verify attendance and completion of the evaluation, a statement of credit will be generated as a journal entry within your profile. Thank you for participating in today's webinar. We'd like to also recognize and especially thank the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day